Welcome back to Stat Nerds. In this video, we are gonna talk about RN salaries versus stress. RNs can make anywhere from $30 to $50 an hour, depending on where you live. But the real question is, does the money really balance out with the stress? Let's break it down, specialty by specialty, and see which areas of nursing give you the best paycheck and which ones take the biggest toll. Med-Surg. Med-Surg nurses usually make around $7,000 to $75,000 a year, about $33 to $36 an hour, depending on the state. But here's the stress side. Heavy patient radios. It's not unusual to have 5 to 6 patients on a shift, sometimes even more if staffing is short. That means constant running, charting, and barely any breaks. Solid money with one of the most exhausting specialties. Nursing home and rehab. Nursing home and rehab nurses average closer to $60,000 to $70,000 a year, around $28 to $32 an hour. The pay is lower, but the stress comes from extremely high patient loads, sometimes 15, 20, or even more residents per nurse. The cases may be less acute than the ICU or the ER, but the workload is non-stop. Meds, wound care, family calls, and endless documentation. It's a different kind of stress, less adrenaline, it's more like a marathon pace. ER nursing. ER nurses average $75,000 to $85,000 a year, so around $30 to $35 an hour. Similar money to Med-Surg, but the stress is different. Instead of high ratios, you get chaos, trauma, cardiac arrest, psych patients, and everything in between can roll in at any moment. If you thrive on adrenaline, it's rewarding, but if constant chaos isn't your thing, the paycheck may not feel worth it. ICU nurses usually make around $80,000 to $95,000 a year, so in between $35 or $40 an hour, sometimes higher with certifications. With the stress, you only have 1 or 2 patients, but they're really sick. Every beep on the monitor could mean life or death, and you are titrating multiple drips, taking care of ventilators and responding to codes. High pay, high stress, and very little room for error. Or operating room nurses can bring in close to $90,000 a year. The stress here isn't patient radius, it's precision and timing. Surgeries are high stakes, and mistakes can have huge consequences. On the flip side, once the case is done, it's done. Compared to ICU or ER, many nurses see it as controlled stress for solid pay. Travel nursing. Travel nurses can make $3,000 or more per week, usually making 6 figures per year. The stress, you're constantly adjusting to new hospitals, new charting systems, and new teams. You might land in an understaffed unit where you're expected to hit the ground running. Amazing money, but very little stability. So is it worth it? When you look at the salaries side by side, the pattern is clear. The higher the paycheck, the higher the stress. ICU, ER, and travel nurses make the most, but they pay for it in intensity. Nursing home and rehab nurses make less, but their workload is overwhelming in a different way. Outpatient and school nurses make less, but often feel more balanced. The beauty of nursing is you can pivot. If one specialty burns you out, there's another path waiting. And if you keep advancing NP, CRNA, management, you can push your salary even higher while trading one type of stress for another.